Hello friends, this small video chat is regarding what happens in a normal knee, what happens in an arthritic knee, and what do we mean by kinematic alignment when we're doing a total knee replacement. So in a normal knee, these are the surfaces of both the bones, and if you see it very closely, that they are smooth and they are blue. Blue means they are full of water. But more important is the surrounding structures. This white band and this white band and the white band inside is what we call as ligaments. It is the ligaments which impart the stability to the knee when the knee moves. Now what happens in an arthritic knee is that the surface erodes, the one on the top, if you see the redness, and one in the bottom, it erodes. But surprisingly, the ligaments are intact. And still, although there is a significant amount of pain in arthritis, but the knee is still stable. Now in a conventional total knee replacement, we often have to remove the ligaments or erase the ligaments to provide some amount of straightness to the knee. But in kinematic balancing, the uniqueness is that we replace the eroded part, and by a caliper we measure that eroded part and we replace it exactly the same amount by metal, amount of the bone which is taken out. The second important thing is that we leave the ligaments intact, and therefore we cause less trauma to the soft tissues. And it's because the trauma is less to the soft tissues and we are replacing the eroded bone with metal, the patient has less pain, the patient is able to move around freely, and the patient gains his or her pre-arthritic state in a very short interval of time. And that is why kinematic alignment of doing a total knee replacement is more natural to a person, and therefore it restores the person's natural knee much more faster as compared to the normal conventional knees.